Wonderful. Thank you everyone for joining us for the next session in our 2021 virtual benefits fair. I really appreciate everyone joining us, those who have been with us for since we started earlier this morning until this period. We have an exciting presentation with one of my favorite people who is going to be presenting for us today. I will say I am Kimberly Williams. I'm your assistant town manager, and joining me in co-hosting duties today is Jessica Rojas. And the third member of our HR team is Tracy Lavoie, who is our payroll and benefits specialist. We are thrilled that you could join us today. I'd like to remind everyone that we are recording this session so that all of the information will be available for you to view later or your team members to review later on our website. Um, the person presenting today, as I said, is one of my favorite, Kelly Morse Perez, and she is with MMHG. And she will be telling us all great things about our health insurance and options. So with that, I will turn this session over to you, Kelly.
Thank you so much, Kimberly. I'm hoping everybody can hear me. Yes. And also, does everybody see I'm sharing the screen that I'm sharing, hopefully, so that I can move through that with you? Okay, hearing nothing negative. So good afternoon. My name is Kelly Morse Perez, and I'm from the Mayflower Municipal Health Group. I'll be talking today about MMHG wellness and the wellness resources that are available to employees, retirees, and dependents from the town of Bridgewater. I want to thank everybody for being here and for your interest in MMHG wellness. As I move through the presentation, feel free to make any notes with questions that you might have, and we'll be very happy to answer them at the end of the session. So we're going to start with the MMHG Wellness Mission Statement, which says, the mission of the MMHG Wellness Program is to improve the health, well-being, and quality of life for all employees, retirees, dependents, and to empower them to adopt positive attitudes and behaviors that celebrate a lifelong commitment to wellness. The MMHG Wellness Program is always evolving and changing. We began many years ago, maybe about 10, maybe a little bit less, with a simple walk 25 miles in 30 days challenge. It was super simple, and we did everything with paper, and it was a success. Now we offer a whole bunch of different types of challenges, programs, grant opportunities for member units, so many things we offer. And when COVID-19 hit last year, we quickly moved from mostly worksite type programs to virtual programs. One thing also is we really recognized the emotional toll of the pandemic on our members and their families, and we concentrated on programs to address that. I'm going to kind of run through some of the programs that we are offering right now. We offer a 3-month premium subscription to Calm, the app. We have that program will be ending soon, and we have a limited number of premium subscriptions left. And if that's something that you'd like to take advantage of, please, you'll be able to contact me. I'll give you my information at the end of the presentation. We offer a free online smoking cessation program for employees and dependents that are enrolled in active non-Medicare groups. It's the X program. It's an excellent program that includes, it's all online and it's completely confidential and private, and it includes tobacco cessation products to help you quit, as well as coaching, online coaching, community, and it has a great track record. We offer periodically throughout the year incentive programs where you can earn gift cards. The most recent being an incentive program for Blue Cross Blue Shield members to take a course, and once they took a course, they received a $25 gift card in the mail. We've also offered gift cards for a colonoscopy incentive program in the past, and are hopefully going to unroll some new incentive programs for our members next year. The Learn to Live program is new. We launched it in March, and this is an online mental health program, again, completely confidential, free, and it's available to all employees and dependents 13 years and older, from all of our member units, whether you have insurance with Blue Cross Blue Shield or Harvard with the town, whether you have insurance with the town or not, you are able to take place in this program. This is, again, a very highly regarded online program where you can, where it's super easy to register, and there's coaching available. There's as well as programs that you can take within the platform itself. Folks that have taken advantage of it give it really high marks, and I truly hope that that it's something that you might consider. We also offer lunch and learn webinars all the time, almost every weekday, most weekdays. And many of the webinars are recorded and posted at our website for folks that can't make it. We offer wellness grant opportunities for each of our member units. And if you're wondering, what is a member unit? The Mayflower Municipal Health Group is a joint purchase group for health insurance. We have 31 different member units, of which Bridgewater is one of them. So when I speak of member units, that means that each of those different towns or fire districts or municipal entity is a member unit, and Bridgewater is a member unit. So we make grants available for smaller programs that can be done at the member unit town level, and I'll talk a little bit more about that soon. We publish a quarterly wellness newsletter. We mail out 1 or 2 a year. We'll be mailing out the spring newsletter to all subscribers that are part of the Mayflower Municipal Health Group, probably in the next week or so. You can also find copies of the wellness newsletter, the current and past, on our website. We offer online challenges all the time. There's usually one running. Right now, we're running an activity step challenge called Go for the Gold. And that's a team-based challenge where your team is your member unit. So it would be the town of Bridgewater. It's all online, and we give raffle prizes to participants, but we've also offered mind, body, heart health, and healthy eating challenges online as well. We offer a savory living, healthy eating program, which is also all online and is something new that we've started offering. Excuse me. You may be familiar with it, and I highly recommend that as well. It includes coaching and an online program which gets super high reviews from people that have participated in it. We have a limited number of free slots available for that program, so that may be something that you want to consider. We every morning you can take part in a virtual guided mindfulness session. Actually, it's not every morning; it's 2 mornings a week. I believe it's Monday and Wednesday. But that's a great opportunity to start your day. We offer virtual and on-site seminars in nutrition, cooking demos, stress management, sleep, virtual and on-site exercise classes like yoga, chair yoga, Zumba, bar, and Tabata. And we also offer when worksite screenings such as blood pressure screenings, cholesterol and glucose screenings, and much more. Right now, because of COVID, we're not doing worksite programs, but we do have a whole bunch of virtual exercise class opportunities that are free and available for our members. Um, there's yoga twice a week, Zumba twice a week. We offer chair yoga, and there's bar. Sometimes, actually, I don't think there's any bar classes right now, but there are Tabata classes on Thursday afternoons. And we're going to be offering a series on gentle restorative yoga that's going to be starting at the end of April. So there's a lot that we offer. If you're new to MMHG Wellness or you need a refresher, the best way to get started is to learn about our programs by signing up to receive our MMHG Wellness email updates and to bookmark our website. These are what this is just a screenshot of the emails that we send out. So you may say, oh yeah, I get those. And if you don't, definitely sign up at wellness@mmhg.org. Just send an email and I will add you to the list to receive these emails. The emails include, as you can see, buttons that you can just press to access information, as well as puzzle. You know, we will have special programs where you can win a prize for doing a word search puzzle, and we also promote our programs through the emails. We also will send out occasionally health and wellness content emails. For example, last week we sent out an email with helpful information and practical tips on supporting children emotionally as they return to in-person learning at school full time. And it was actually a really great email. So that's another reason to sign up to receive these wellness email updates. And our website, if you're not familiar with it, please bookmark it. It's a really important resource for MMHG members and retirees. In addition to benefit information like plan information, benefit comparisons, information about the health insurance plans that we offer, there's also a really robust wellness section on the website that kind of has everything that you would need to know. There's a calendar of events, so you can kind of pop in each day and click on the date, and you'll see what events are happening on that day. You'll find promotional flyers if you click on the link for wellness program flyers, virtual programs, challenges, incentive programs, webinars, and healthy cooking demos. Every flyer is listed there, and each flyer has registration information and a description of the program. And there's links to current and past newsletters, a monthly schedule, and other information as well. And I thought I would include a few photos of past events when we were doing Insight programming, just to kind of get it. So just so you can get an overall sense of what kind of programs we do. The town of Halifax for many years planted a really large worksite vegetable garden with wellness grant funds from the Mayflower Municipal Health Group. And this is a photo of their harvest. And employees were able to volunteer to work in the garden. And they did that before work or after work or on their breaks. And for working in the garden, weeding, watering, that kind of stuff, they were able to bring home vegetables, fresh vegetables. We did several years back, we had a registered dietitian led us on we went to a farm in Pembroke, and there was an organic farm with vegetables, chickens, honeybees, the whole bit. And bunch of folks got together from Mayflower Municipal Health Group and received a tour of that farm, and it was a lot of fun. groups do. In Hanover, there was, there was a Heart Health Month employee event where everybody wore red and information about heart health was distributed, and there were raffle prizes. We've done gardening workshops. We've done lots of them. And the MMHG Wellness Committee meets quarterly, and the committee is made up of representatives from each member unit. And at those meetings, we make plans on the kind of programs that we're going to offer members. And then this is the West Bridgewater Nutrition Workshop was a lot of fun. That was a multi-week nutrition program, again, led by a registered dietitian. And that was super fun. And we've done lots of nutrition workshops on site as well. And one of our most popular on-site fitness classes is Zumba with local instructor Debbie Rafferty. This is at the Kingston Recreation Center, but we've done Zumba in the town of Bridgewater. We've done it in other locations. We've had yoga classes in many of our member unit communities, and those classes are always free and open to all employees of Mayflower Municipal Health Group member units. I'd also like to take a few minutes to talk about the provider wellness programs. So Blue Cross Blue Shield provides wellness programs as well to its members. On here. So I'm not sure if you know, but Blue Cross Blue Shield members are eligible for up to a $300 annual fitness reimbursement benefit. And now that includes reimbursement for qualified virtual fitness classes. So that's brand new. That's actually starts July 1st of 2021. But it's a great benefit, and you should definitely, if you go to a gym or if you take yoga classes at a yoga studio, you should definitely look into getting your reimbursement. Blue Cross Blue Shield also offers up to $150 annual weight loss program reimbursement. So that would be for any hospital-based type weight loss program, Weight Watchers, and it also includes online programs like Noom, which you may have heard about. That's all over lots of commercials on TV about that. Weight Watchers Online, and the Savory Living program, which I spoke to you about a little while ago. And they have a Healthy Me website, which is a member website for wellness that you register for, with lots of great wellness content. And I just wanted to remind people that the Blue Care Line, which is available to Blue Cross Blue Shield members, you can actually call 24 hours a day, 7 days a week, and speak to a specially trained registered nurse who can answer your questions, medical questions. It's great if it's, 2 in the morning and maybe you're wondering, do I go to the emergency room or not? Of course, if it's a true emergency, go to the emergency room, don't make the phone call. But maybe it's like an earache or something like that. And the nurse can evaluate what's going on and give you some good advice on that. So it's a really great resource that's, I think, underutilized. So I like to remind people about it. So the Healthy Me website that I talked about, they have so you register for this, and as a Blue Cross Blue Shield members, and it includes all kinds of information about health and wellness, healthy recipes, tips, lifestyle tips, lots of tools, videos that you can watch. And it also includes a library of conditions and treatments that for those conditions, if you're looking for just looking for information. It's great. You can also take a health assessment, and you can also find out about the savings and discounts that are available to Blue Cross Blue Shield members. So if you're a Blue Cross Blue Shield member and you haven't signed up yet for Healthy Me, I do recommend that you do that. And for Harvard Pilgrim members, the same. Harvard Pilgrim members receive up to a $300 annual fitness reimbursement benefit, and that includes reimbursement for qualified or virtual fitness classes. So that's a new and really great addition to that benefit. And also, you can get an up to $150 annual weight loss program reimbursement. I don't think virtual programs are available under this weight loss benefit right now, but that may change. But definitely any hospital-based type weight loss program, and I believe Weight Watchers as well, the in-person meetings are reimbursable. And they also have a healthy wellness account for members. It's called the Living Well Everyday Wellness Account, which is similar to a Healthy Me with Blue Cross Blue Shield. It's really great, and Harvard Pilgrim members should absolutely sign up and check it out. And Harvard Pilgrim has, during the pandemic, Harvard Pilgrim has been amazing in offering a lot of free virtual wellness programs, which we've been promoting to you directly. It's called the Living Well at Home with Virtual Wellness. That's what they're calling the programs, and those have been free programs that are actually open to anybody, not just Harvard Pilgrim members. That's a great resource. And here is a screenshot of the Living Well Everyday member website for Harvard Pilgrim members. So some of the, there's financial wellness, physical activity, healthy eating, health plan literacy, which is super important, I think, mindfulness and meditation, self-care, stress management, just lots of content, lots of quality content. And you know, that's a resource. That's a resource that you're getting by being a Harvard Pilgrim member or a Blue Cross Blue Shield member, and it's definitely something that you should look into. And we offer some smart consumer programs, which are programs that are designed to help members save money. Telehealth is something that really took off during the pandemic for obvious reasons, especially for behavioral health. And with telehealth, members can visit doctors and providers anytime, anywhere in the United States using a smartphone, a tablet, or computer with a webcam. I don't know. You know, our numbers have really gone up in terms of utilization with telehealth, and we've done it in my house with telehealth therapy, and it actually was really a great resource for my family during some rough, during a rough year. And it was super easy to use. And right now, there's no copays for behavioral health visits through telehealth. I don't think that will continue forever, but that is something to consider. We offer for Blue Cross Blue Shield members only, there's a Smart Shopper incentive program. And for Blue Cross Blue Shield members can receive a reward for shopping for high quality, lower cost services. So you can actually call the 800 number at Smart Shopper and say, I'm having an MRI. Where's the place that I can go where I can receive a reward? And you can get a check for anywhere up to $250. So it's kind of it's definitely worth checking out. We offer a Canna RX prescription drug program, and this is for members that are taking brand name maintenance medications as prescribed by their doctor, and you get those in the mail with no co-payments at all. So that's something that can certainly save you money if you're taking a brand name maintenance medication. And the Shield Simply Save, depending on your plan, when you choose a Shield's facility to get an MRI, a PET CT, or radio oncology services, you do not have to pay a copay. So that's a great benefit if your plan includes a copay for those services. And I'm going to wrap it up here, and then I'm happy to answer any questions you might have. So if you want more information, that was a super general overview of the programs that we offer. But you can send an email to wellness@mmhg.org with any questions or suggestions that you have, to sign up for wellness email updates if you are not receiving them. And also if you just for any question that you might have about any of our programs. Or you can call me directly. That's my phone number, 774-773-9306. I'm happy to help you. I love to get phone calls. And just so that you know, Kimberly Williams is your wellness coordinator with the town of Bridgewater. So you can always whisper in her ear about any programs that you would like to see happen at Bridgewater, or for any questions that you might have for her. I hope you enjoyed this brief overview, and I want to thank you so much for being here and for your interest. Are there any questions?
We did have one question in the chat from Ann Laracy. When is the reimbursement form due?
Oh, okay. So so it runs on a calendar for the fitness. I'm assuming this is for the fitness and the health insurance, the weight loss reimbursements. Those are done in a calendar year. So for 2000, it's too late for 2020. You have to for the last calendar year, you would have had to have applied for your reimbursement by the end of March. For this year, you have until so for calendar year 2021, you have until March of 2022 to apply for your reimbursement. There are some other, each of Blue Cross and Harvard Pilgrim each have a little bit different instructions on when to apply for your reimbursement, but usually I would wait until you've spent up to 300, if you're a active in an active non-Medicare group and you are getting $300, you're eligible for $300 fitness benefit. I'd wait till I've spent that much out of pocket, because you can only do it one time. So you can't do, okay, I'm gonna get reimbursed for $75 now, and I'd like to, and then maybe try and get $75 later. You can't at all. You can only do it one time per calendar year.
That helps.
Okay, is there any other questions before we end this session? And again, like Kimberly previously stated, this is being recorded and it will be uploaded to the town's website later on today. Is there any last minute questions? And just a friendly reminder, open enrollment begins today. Open enrollment is from Thursday, April 15th through Friday, May 14th. This is the only time you can make any changes to coverages without having a qualifying event. Thank you, everyone, and have a nice day.